Hi, I'm the production editor of Core and Bath's quarterly journal, Adoption and Fostering, and I'm joined by the journal's editor-in-chief, Dr. Dennis Golm from the University of
Hello.
Southampton, and also one of our authors from the March issue of the journal, Dr. Tam Cane, who's senior lecturer in social work at the University of Sussex. Hi, Tam.
Hi, Victoria.
Lovely to have you with us. So, Dennis and I would just like to have a chat with you today about your article, just to find out a little bit more background, give you the opportunity to share some of the key aspects of the article. So the title of the article is The Braced Model, an approach to de-biased decision-making in adoption assessments with prospective adopters from minoritised ethnic groups. So this braced model is a new approach that you're bringing, isn't it, Tam? So just maybe a summary of your article and the model. Where do we see racial bias in adoption assessments? How did this model come about?
Thanks so much, Vicky, and Dennis. Thanks for having me. So I guess my starting point really with the braced model is to start off by highlighting the barriers and challenges experienced by ethnic minorities in the adoption system. So if we start off thinking about the data around ethnic minority children in the care system needing permanency, looking back in the 2021 statistics, you'll find that actually in the paper I referred to the 2020 statistics, but to be timely, let's bring it forward a little bit. So 2021 government data reported 80,850 children who were looked after. And of that, 24% are from ethnic minorities. But of course, within the 24%, you can break it down per ethnic grouping. Then if we want to shift that to think about adoption, 2,870 of those children were adopted, 84% being white, 10% mixed race, 2% black children, Caribbean and black British, 2% being Asian, and 1% is other ethnic minority groups. Then we want to think about another DFE report that was prepared by Burnley and colleagues in 2021 again, and they looked at 471 prospective adopters in regional adoption agencies. And of those 471, they found only 9% who were of minoritized ethnic backgrounds, 2 identified as black, 23 as Asian, and 13 mixed race, and then 3 who were unnamed. That's the data we know. But in terms of independent and voluntary agencies, we're not really clear what the data is. But what we know from the evidence is that actually we don't have enough ethnic minority adopters available to adopt the ethnic minority children within the adoption system. So that is a challenge for us right at the beginning there. And I wanted to frame that, I guess, as a foundation to the paper for us to appreciate the reality of this. Now, if we then want to look at the existing research that helps us to understand what might be going on, we know that there could be cultural and religious norms and expectations around why ethnic minorities might necessarily not adopt. There could be expectations around childbirth. And then we also know that in African and Asian families, they might have larger families and they might prefer to raise their own children. But actually, some cultures also within that group encourage adoption and fostering and for altruistic reasons or any other reasons like that. But then when we then want to get to the reality of what is happening for those ethnic minorities who are coming forward to adopt, we know from research that, and from some of my work, that there might be concerns around misconceptions around adoption, inaccuracies around the type of person or their social status who might be considered for adoption, or the age or the type of family that might be considered for adoption. But we also know that there might be also concerns around how intrusive the adoption assessment process can be. But then if we then want to look at procedural barriers, we know that there can be subjective views around spare bedrooms, whether or not before you come into the adoption system, you need to have a spare bedroom, whether that bedroom needs to be decorated before or during the process. And then we know that there's some differences in bedroom sharing policies across different agencies, and what may also be different in terms of the reality of what Beth children do. Actually, we know that Beth children sometimes do share bedrooms, and that's normal. And then coming into the adoption system, the expectations may well be different. Then we know that social work, as it were, and also within the adoption system, looks at the assessments in a very Eurocentric way. So it is really thinking about that Eurocentric approach. What does that mean when it comes to the reality of a prospective adopter from an ethnic minority coming in to adopt? What does that mean for them? Then there might be concerns around how those narratives after an assessment are presented, whether it's presented in an accurate way. I think this is a challenge for social workers. And also, I think a big point that I wanted to highlight as well in this paper was how, from some of those people I've spoken with, around how endless requests or care during the process. So endless requirements, you meet that requirement during an assessment, and then there's something new that's presented, something new that is required, therefore presenting a glass ceiling, and that this process is fraught with difficulties. And we know that there's been concerns around too many lifestyle judgments, resulting in unfair and inaccurate judgments around other ethnic minority people who might be bringing themselves forward to adoption. I'm not suggesting that all social workers who are assessing ethnic minorities are coming into the process with bias, but the idea that actually bias exists, the idea that social work comes with a lot of power, the idea that within the adoption system, actually, we do not have a representative or a good representative of ethnic minorities themselves who are adoption, who are adoption social workers as well. So there's that lack of representation within that. So the reason I wanted to introduce the braced model was to provide a tool that supports social workers with through their decision making processes when working with prospective adopters, particularly from ethnic minority backgrounds.
Very interesting. And how can your model help with that bias, or with that potential bias, I should say, maybe?
Okay, so the idea is that within this model, to start off appreciating that there are a range of cognitive biases that might occur during an assessment process. So, braced, if we want to look at B, what the B means within the braced, it's a starting point of becoming aware. So, B means being aware of your bias. So, within this phase, what I'm doing is encouraging practitioners to come in with an appreciation that there's difference in race, difference in culture, difference in ethnicity. So coming in to avoid that color blindness and appreciate difference, and thinking about that privilege that I mentioned earlier, and thinking about, based on your own race as a practitioner, what might be the power that might occur. And if we're thinking about, maybe if it's a white assessor, what does that mean in terms of their white privilege, and thinking about white fragility and the readiness to appreciate that bias that comes with your role and also your identity as part of this process. So within this phase, I think it's important to consider simultaneous and multiple disadvantages and the struggles, not only through anti-oppressive practice and anti-discriminatory lens, but thinking about an intersectionality lens, thinking about anti-racism, anti-oppressive practice, anti-discriminatory practice, and not necessarily placing a hierarchy where these multiple disadvantages occur, but really appreciating that we need to confront the bias that might be associated with this. And this debiasing process is also about confronting, as a practitioner, your own worldview, but also the organization's positionality, policies, procedures, legislation, and it might be senior managers or team biases that might tend to influence decision making, whether or not they're coming from a position of bias as well. Then R in the braced involves engaging and reviewing in internal conversations. And what I mean by this, it's a process of reflexivity, looking at the strengths, looking at the gaps in the assessment, but also being careful about anchoring onto previous assessment decisions, perhaps that might also be influenced with bias, but also it involves a process of questioning And maybe it might be questions that provide some prompts in the tool. So it might be questioning things like, what mistakes have I made before? What mistakes can I learn from? What is new from this assessment that I need to look at carefully without holding onto preconceived and inaccurate views? Am I judging this individual or this family or this couple based on a monocultural focus that may undermine the value of ethnic minorities' parenting norms or their practices that they value as a family, for example? So then when we think about the third step in this process, it's really about considering ambiguity that might occur in decision making. So A is ambiguity. Consider and deal with the ambiguity in decision making. So this process involves assessing and carefully scrutinizing the ambiguity that might occur as part of that assessment. But then I'm providing, to help social workers, I'm providing some prompts again, thinking of questions like, what is it about this assessment or this individual, this couple, this family that is ambiguous? What is ambiguous from their narrative that they've given me? What about their lifestyle, their culture, how they're presenting? And what is it that is making me unsure or uneasy or uncomfortable about what I'm hearing or what I'm observing or what I'm seeing? And then really questioning about questioning that in terms of how that relates to your own identity, your own experiences, but also thinking about what is my point of reference? What am I missing? Why do I think something is missing? So really being reflexive, but with that reflexivity needs to come with a high level of self-awareness and also self-scrutiny to be able to evaluate that ambiguity. But that might also be about language, the language that is being used. And here I started thinking about experiences of migration, for example, and how in adoption it's important to think about support networks. But what does that mean for somebody who's coming into the adoption process and is still building their social networks? What about their religion? What about their cultural norms? What about their health status? Am I being overly judgmental, maybe? Am I having too much expectations compared to what a white family, for example, might bring? My area also of, in terms of adoption, is around HIV. And I gave an example around HIV and some inaccuracies that we've seen in my research previously, where sometimes a person with HIV who might come to apply for adoption might be inaccurately considered, and maybe concerns around the child's long-term stability being affected because an adoptive parent or a prospective adoptive parent is HIV positive. But actually, we've moved on from that. We've moved on from HIV being a death sentence, for example. So it's really thinking about what is health, this particular health status like today. Am I accurate in my assessment? Am I not being biased? Am I accurate in the knowledge and education that I have about this situation, this culture? And and these issues that are being presented. So in general, this phase is really asking practitioners to confront the ambiguity effect, which may lead to rejecting an assessment because maybe as a social worker it feels too risky to approve a prospective adopter or due to a divergence in values or beliefs. Then C involves cognitive resources. So having an appreciation of cognitive resources that might help or aid decision making, and which also supports in terms of being evidence based in decision making. So within this stage, I think I wanted to start off by appreciating that cognitive bias comes from the fact that we're taking cognitive shortcuts, okay, that prevent us from engaging really carefully and closely with cognitive resources. So the idea here is that it's important to evaluate whether, as practitioners, we're using the right tools to inform our assessment, and the tools that we're using, are they valid? Are they really useful and thorough in helping us to make those decisions? And also to help think about, what about that preparatory bias that I had? Have I reviewed that? Have I sought the right information to understand this culture? Have I done a lot of preparation, good level of preparation, to before coming to this assessment? Am I skilled enough? If not, What can I do? What expert can I seek, or who can I approach to try and access authentic information that can help dispel prejudice and negative preconceptions, I suppose. So then C in the model is about changing perspective, and it's about changing one's perspective through a sequence of what I've already spoken about, perhaps being unaware of your bias, being aware of your bias, and then thinking about contemplating decisions that are based on bias, but actually deciding to change and initiating and accomplishing, as well as maintaining the change in a way that is not coming from a process of bias. So, to change one's perspective, one needs cognitive resources. They need the motivation and a clear direction for change without resistance and with self efficacy. So it's really about moving away from assumptions and negative views about certain groups within ethnic minorities. It's challenging views that when an ethnic minority challenges decisions, we are then not moving into a place where there are stereotypes about, well, they're being unreasonable, well, they're an angry black person, or they're bitter, for example. So it's removing those ethnic penalties that may arise as a result of bias and behavior change techniques. So we then talk about education, which is E in the BRACED model. So we know that there are lots of critiques around the usefulness of unconscious bias training. I think it's important to acknowledge that. So within this education phase of the BRACED model, the argument is that it's not always enough just to access education. But what's important is to act on that education, is to avoid virtue signaling and tick boxing. So it's really to think about, actually, I've accessed this education. What can I do? How can I shape? How can I use this education or training to shape my thinking, to shape my practice, and be really being able to challenge others? And again, within this phase, I use a lot of reflective questions, and some of them might include, what reminders do I have? What reminders can I use to de-bias? Thinking about cognitive nudges that can help to think about this. And am I writing this report in a way that is fair? Am I using the right language? And is it really reflecting the cultural standpoint or worldview of the person that you're assessing? What examples can I use to appreciate implicit bias when working in this racial or ethnic or cultural context, for example? So the tool is helpful in its way by providing those reflective questions and really guiding social workers with some examples around where that bias might occur. So the seventh phase in this model is deliberating. So deliberating, which is D, deliberate and disconform bias and automatic responses. So again, it's really thinking about fully acknowledging the benefits and the risks associated with certain decisions and the impact it might have actually within that within the children, for the children that are waiting to be adopted. Thinking carefully about the solutions that may be available. And again, that disconforming process allows a practitioner to think about, what were my old habits and how can I avoid going back to those habits, and really thinking about being accountable for your decisions and developing strategies to avoid reverting back to a position of bias, and being aware of your practice and decision flaws. So this is the tool. It's quite long, but I think it's important when we're thinking about BRACED that it's it's an iterative process. It's not stagist. It's really thinking about, where am I in this stage and how can I make use of this tool to support you. So it's BRACED. B, being becoming aware of your bias. R is reviewing internal conversations. And A is thinking about ambiguity in decision making. And C is cognitive resources. And there's another C, that's why it's braced with the two at the top, which is change perspectives. And then E is education. And the final one, D, being deliberate and disconform bias and automatic responses.
Fantastic. When you were talking, I thought, obviously, one advantage of using the model would be that there might be more diversity within potential prospective adopters. But I was thinking, but also that would then have knock-on effect, because that would obviously have advantages for children from diverse backgrounds being adopted. Could you briefly mention what those would be?
So you mean in terms of the diversity for those children? I think thinking about diversity now is a very, very interesting question, Dennis, because when we're thinking about ethnic minorities, within that, there's so many, it is diverse. So I think it's important to take individuals as unique and being able to see where they're coming from in terms of um, their their cultural and ethnic backgrounds. So, and even within the diversity around Black children, there's Black Caribbean, there's Black British, there's Black African, and within British and African are differences within that as well. And we're thinking about Asian backgrounds, and we're also now thinking about, actually, when we're talking about ethnic minorities, it might also be a white ethnic minority family. So I think we really need to take a lot of caution when we're thinking about diversity and take people as unique individuals and their cultural backgrounds as unique as well. And you're so right, it's important to think again of the the different ethnic groups that children who are waiting for adoption are coming from, and that brings in another lens in terms of what is it that's happening in those assessment processes, what is available in terms of helping social workers to understand the cultural backgrounds of those children. And that's another piece of research, I think, in terms of thinking about birth parents, helping that process for social workers to truly understand what those cultural needs are for those children. So, and that's another discussion around matching and what needs to happen around that. But I think if we really want to think about that recruitment process, it's really important to understand individuals as unique people, what they're bringing to the process, and really thinking about where we're coming from as social workers, our own biases, and thinking about being ready and willing to confront that. Alongside that, being willing to be challenged for our mistakes that we make, but not being fearful of making mistakes. So it's really thinking about, if you remember that point about what mistakes can I learn from. So we do need to appreciate we can make mistakes, but we also need to be open to learning and not necessarily do this work with a way that is oppressive and discriminatory and harmful, because to be harmful is much more dangerous, and trying to rectify that, it's very difficult then. So it's really trying to help us think about really what are we doing in our practice to be inclusive and anti-racist and anti-oppressive. Does that answer your question,
Yeah,
Dennis?
I think it does. I was thinking, I think it does much more. It elaborates on it, because I was thinking just in case of adopted children being a minority, and then if, let's say, a Black British child is adopted by white parents, then we have the double minority status maybe later on. So I was thinking along those terms.
That's a useful way of thinking about it, because currently there's a lot of work going on, and I'm actually involved in a piece of research looking at how can we support adoptive parents who are transracially adopting children. So within that, they require a lot of support. And if you look at research, particularly research from America, we haven't got much research here in the UK that looks at experiences of people who have been transracially adopted and what that means in terms of their identity long term. And there's a lot of learning to take from that. So some of the work that's moving forward is what do we need to do to support parents who are transracially adopting, to make sure that they too are able to meet the needs of their child, so that they're ready to deal with any challenges that might come about in relation to their identity, and that they're willing to actually say, my experience is going to be different from my child's experience, and how can I reconcile that and make sure I give my child the best chance in terms of developing their identity and exposing them to cultures, environment, to people, activities, whatever else it is in terms of socialization, so that they develop confidence in their identity and who they are in the long term.
Thank you. Sorry, I'm realizing we have to have an eye on the time. But I thought one useful question might maybe be if, and hopefully loads of people do, when people read your article and say, oh, I would like to know more about this, or actually I think we would need some training maybe within our local authority, where should they go?
Okay, so I'm based at the University of Sussex, so you can email me. It's Dr. Tam Cane, University of Sussex. I'm based in the social work department, and my email address is tam.cane, C-A-N-E, at sussex.ac.uk.
Fantastic. And for practitioners reading your article, as you were saying, Tam, there's so many questions, prompts in there that give this advice, guidance for how to be reflexive, how to shake up practice wisdom, how to view people in a unique way and not just end up at the doorstep making questions and asking questions that they should have been asking some time back. So really, really useful practical piece, as well as so much research in your article. Thank you so much for talking through it with us today. We're really thrilled to see your article published in the March 2023 issue of Adoption and Fostering, Volume 47, Issue 1. It's been really lovely to hear more from you. So that's the braced model, an approach to de-biased decision-making in adoption assessments with prospective adopters from minoritised ethnic groups. And just a reminder that Adoption and Fostering is free to all members of Core and Bath and can be accessed via the members area of the website with your membership login details. The table of contents of latest issues is there as well. Thank you so much, Tam, and thank you, Dennis, as well. Lovely to see you both.
Thank you both for having me. Thank you. I'm thrilled with the publication. Thank you.
Well, thanks for being here.